thank you for coming. Welcome. We do have some dignitaries I'd like to recognize. We have Cheryl Grebe from the County Commission, Vivian Janner, who's the chairwoman for the County Commission, Sarah Shaw from the city of Kissimmee, and Mayor Jim Swan. Our county is currently involved in doing a strategic plan for the future vision of this county. And a lot of us are involved in that process and are working with Dr. Bob Porter, who is managing this initiative. But what you're going to see here today is actually, it comes out of a strategic plan that was completed in 2009. And I was very involved in that particular strategic plan work. The number one goal of that strategic plan in 2009 was to have a central receiving center in Osceola County similar to the operation in Orange County, which had been so very successful. So we wanted to do it in 2009, but we didn't have the money, and the county didn't have the money to do it either. But through the support of the county and the fact that we sold our Sunnyside Children's Home property, we suddenly had the funds to do this. So what you're going to see today is how we use the funds from the sale of that particular operation to expand our services here. I'm not really going to say too much more because I believe that our unit will speak for itself. I honestly believe this is the prettiest and most creative crisis stabilization unit anywhere in the state of Florida. And I'm anxious for you to see it. So I would like to just go ahead and cut the ribbon and then have you come inside. We got it?
Go
okay.
Ahead. Go ahead, Jim.
There we go. All right. But what we'll see right now is really the centerpiece of the whole program. So you're welcome. Follow us. We've just completed our expansion here. We've added 30 new adult beds. But we did something a little unusual, which I think is very creative. We just didn't build a wing with an 8-foot corridor. We built a unit that has a 30-foot corridor, and plus we have very high ceilings here, so with windows all around. So what you have, it's so spacious that it's absolutely not claustrophobic at all. All the people who are going to be admitted here are people who are having some kind of a psychotic break of one kind or another. Things could get very claustrophobic and difficult for them. They don't like being in small spaces. So this is really unique in that it's so big that you don't feel closed in at all in a unit like this. So we just think it's a very unique unit. I mean, I don't know if you'll find another one in the state of Florida that's built like this one, but this is what we wanted from the beginning. This is what we told our architect that we wanted, and he designed it like we asked him to. The commitment we have is that we never turn down law enforcement for any reason. They can bring people here that they pick up who need to be Baker acted, and that is in an involuntary admission for psychiatric care. They can leave the patient with us and go. So it shortens the amount of time that the police officer has to stand around a facility waiting. And the other thing is they can bring a lot of people here who have broken the law. In other words, they could legitimately take some of these individuals to jail and just book them into the jail. But oftentimes the underlying problem is that these people are mentally ill and they do foolish things that are just unexplainable. And if they get into the jail, they could be there for 90 days. It's a huge expense for the county to hold them in a jail when they really don't need to be there in the first place. If they bring them to us, then we can work with them. They may not stay in our crisis unit, this unit, very long, but when they're discharged from here, we set them up for appointments in our clinic building so they can get follow-up from a psychiatrist, keep them on their medications, therapy if they need that. So I think this will be a real asset for the community, I really do.